Hello, good evening. Mic test. Okay. Hello. Hello, chat. Magandang gabi. Good evening. Oh wait, I forgot to hide this. I'm on YouTube right now, so I can take these out. Hello! Wait, oh my god, parang dami nyo yata. Pokari, hello, Kyosha, Archetype, Popmaster, Libby, hello, Skyler, hello. Ba't dalawang Popmaster? Ventix, hello, Switchcon, hello. Noah's Arch, hello, Eddie, hello. Partially, hello. Magandang, hey, Sela Van Rick, hello. Hello. I actually saw you in Cosmania. I mean, the booth. I just passed by. I passed by that booth in Cosplay Mania and got business cards. I was just walking around and then getting business cards, and then I saw the Relium booth. Yeah, the booth. Not you, but like the booth. I think you guys were live in that booth though. You guys were like doing meet and greets, yeah. I was just walking by in the background of the Alright. Kamusta, Doc? Okay naman ako. Kiyos, nakabili ako ng artwork ng Shiori. Oh yeah, I saw there was someone was selling ano to? Poster of me. Unfortunately, when I was there, I wasn't able to find it. Hindi ko nakita, so I wasn't really able. And besides, I was on a tight budget that day, so I couldn't really buy much. I only bought like stickers and small keychains. That's it. I didn't really buy much because I was on a tight budget. Sabi ni YouTube, send daw ako ng member milestone. Salamat sa member milestone chat, send Darrell. Salamat. You should randomly be shouting, "Uy, si Doc at Conto scared." I don't think that's gonna work because, you know, there's stuff happening on stage, so I wouldn't hear it. Kasi I would hear whatever's happening on stage. Kakalanding ko galing airport 2 hours before ako pumunta sa Cosmo. Oh, you just came from the airport? Doc poster with autograph when? Soon. Right now, cause I'm prioritizing stuff. I mean, like, I'm prioritizing the stuff I need to do, so that Donathon I'm planning is a priority. And then I still have that out for raffle. And then the merch, yeah. Uy, 4 months na. Also, nakalipad na ako pauwi naman. Oh, thank you for the member milestone chat. Alright, so anyway, chat. Wait, I forgot to. Where's my PowerPoint? My PowerPoint presentation. We're going to talk about GERD, or Gastroesophageal Reflux. Teka, wait, I need to wear my glasses for this. Glasses. There we go. Oh no, wait, where did I save it? GERD. Where's GERD? Wala dito. What? Oh no, wait, where is my PowerPoint? Ala. Wait, what? Ala, di ko mahanap. Where'd I save it? What the? I'm pretty sure I saved. Oh. Okay. I saved it on the wrong folder. Wait, ito. And I forgot to edit the title. GERD. Okay, let's see. Here we go. Sobrang ganda talaga nung magbabasa nito ng malakas. Wow! Wow! Paano kung yung lahat ng chat binabasa nila out loud ng malakas? Eh di sobrang ganda din yung chat ko. Kunwari si Fapmaster, binasa niya yan out loud. Ibig sabihin, maganda siya. Sobrang ganda. Ganda ko. Alright, okay, hold on. Let's set up the wala yung slides ko ito. Where my slides? Okay. Okay, chat. GERD. So, the topic, the reason why I chose this topic is because... Wait lang, I want to change the BGM. Let's change the BGM to this. The topic... I chose this because apparently I made a tweet, or I quote retweeted someone like a few weeks ago. 2 weeks ago, I think. And it was about GERD. Apparently, I was kind of surprised that some people, or me, I don't know if it's some people or if it's a lot of people, but a lot of people have GERD, and some people don't know or don't realize how serious GERD can be. I mean, at first it doesn't seem that serious, you know. It's like just an acid reflux. I'm just regurgitating. Sometimes it happens, but it's nothing that bad. It can be, I mean, it can be mild like that, but GERD can be more severe depending on your symptoms and how long you've had it. I'm on the side of those who don't know GERD. Yeah, GERD is acid, basically gastroesophageal reflux disease. Sometimes they call it acid reflux. Some people call it acid reflux or reflux, gastric reflux, you know, anything reflux. That's what it is. That's what it is. Like, it encompasses, it can be very mild, but it can also become severe to the point that, you know, you really have to be on maintenance medication, or sometimes, ultimately, if that doesn't work, you're gonna need surgery for it. I only usually know GERD in relation to pregnancy. Oh yeah, it can happen in pregnancy too. Is it like stomach ache? Yeah, you can have like stomach aches, but it's more like heartburns. It's more like heartburns. Cause of the acid. It's because of the acid, like going up your esophagus. But yeah, GERD can happen in pregnancy because especially of the hormones and, you know, mechanically, like if the woman's uterus has a baby inside and it's growing and growing, it causes some pressure in the abdomen, so it can lead to, like, it can push up on the stomach and the acid just passes up. Alright, let's go. So we'll go talk about, okay, before we talk about GERD, okay, we gotta, if you remember my esophagus and stomach medical education stream, I talked about stomach and esophagus like a few months ago. So the first few slides is from that because it is important to know the anatomy and the physiology or the anatomy of the esophagus and the stomach. Okay? So we're just gonna go through this really briefly. Actually, this presentation is like only like 20 plus slides. So esophagus, yeah. So your upper gastrointestinal tract starts from the mouth. Okay, so you can like eat your food here. Eat some food. Yeah. Let's say you're eating you eat fried chicken. But I got a drumstick, okay? Which is the first step in digestion starts in the mouth. So you're gonna chew the food, chew. Your saliva helps in digestion, and then the next step after chewing your food is that you're gonna swallow. So when you swallow, your epiglottis is going to cover the airway because your esophagus is pretty much right next to the airway or the trachea. Or behind it, actually. So you can see, that is why we can breathe through our mouths. Because look at this. This is the opening here. Your epiglottis will, when you swallow, your epiglottis goes down and seals this so that the food just goes straight to the esophagus. Okay? So, swallowing is actually, a lot of things happen when you swallow. So there's like a mixture of this, the epiglottis going down, your tongue pushing the food, and the muscles of the esophagus working. But one of the important things in swallowing and in the pathway for the food to go to the stomach and to stay in the stomach, it's here. Okay. There is a sphincter in this area called the lower esophageal sphincter, or we just call it the LES. It's a very important structure. Okay, and wait, do I have a slide on it? Here we go. Okay, this is just parts of the esophagus. We don't need to know this. We don't need to go too deep onto this, but the lower esophageal sphincter is here in this area. Okay. In this area. This is just showing the length of the esophagus. Alright, here we go. Purpose of the esophagus. So, it's for transport, food transport. Swallowing, protection against reflux. That's where the LES is important. Okay, the LES is what protects the lower esophageal sphincter. Has to be working properly so that you don't get a reflux. Okay? So, if your LES... Oh my god, wait. My mouse... Wait, what? Okay, it's working. I think the drag on my mouse is it's messing up. Okay. Look at that! It's not straight! Ayun, okay na. Okay na. I think my mouse is starting to give up on me. Anyway, so the lower esophageal sphincter is what protects your esophagus from the gastric acids going back up. Hello, first time tuning in here. Hello, Karen. Welcome. Welcome. I feel like I'm in med school now. Yes, this is Shiori's med school. Alright. Now we go to the stomach. Hello, Updog. Hello. Does that mean mine is broken? Well, your LES? It's probably not working properly. Most likely that is. Okay, the stomach is located on the left side, or at least a chunk of the stomach. It's, the entrance is a little towards the left, and then your stomach here goes from the left to the middle upper part of your abdomen, the epigastric region. Okay? So yeah, that's all you need to know for this one. Since we're just talking about GERD. Okay. So, anatomy of the stomach. The stomach is made out of some muscles here. We have different parts. Over here, see, oh, this is the important part. Oh my god. It's not my mouse. Okay, here we go. This is where the LES is. The LES is in that area. My mouse is giving up on me. See? So if you have gastric contents in your stomach is like a storage and also helps in digestion. So what is supposed to happen in the stomach is that after you swallow food, your food goes to the stomach. It's supposed to go down here. There's another sphincter here, the pyloric sphincter. Food is supposed to pass by here, and it's supposed to go to the small intestine. Now, if there is an abnormality here in your lower esophageal sphincter, let's say your lower esophageal sphincter is only supposed to relax when food is going down. And then after that, it's just contracted so that food in the stomach doesn't go back up. Okay? Now, if your lower esophageal sphincter is not doing its job properly, not contracting or sealing your esophagus up, then that's when food will pass through, will go back up. Okay? So, usually, there are some, what do you call this? Esophageal disorders, but most of them are like where the esophagus is not contracting and then the LES is acting normally, or the esophagus is contracting so much and the LES is like super contracted. And those are more esophageal disorders. They're not really GERD. Okay, those do not lead to reflux. Okay, purpose of the stomach. Okay, purpose of the stomach, like I said, it's for temporary storage of food. It also mechanically breaks down the food, so for digestion, and then produces enzymes for digestion. Okay. Now, we go to GERD. We go to GERD proper. What is GERD? GERD is basically, as I said before, gastroesophageal reflux disease. Some people call it acid reflux. Some people call it gastric reflux. Or they just say, may reflux ako, may acid ako. You know, a lot of people have different terms for it. May acid ako, may reflux ako. I have acid. I have reflux. I have acid reflux. GERD sounds like a gastro disease. Well, it is. It is. Oh, my GERD. Good morning, Dakshion. Hello, CJ. Welcome. Good evening. It's evening over here. Okay. So what is GERD? It's simply when gastric juice goes back up to your esophagus. That's the simplest definition. Okay. Is hyperacidity the same with GERD? No, not really. But as long as that acid in your stomach is going back up to your esophagus, then that's a reflux. Because it's not supposed to. See, look at this. This is the LES. The sphincter is supposed to be closed when you have stuff in your stomach, right? But if it's not working properly, your sphincter opens and the acid just goes back up. Okay? Okay. So that's what you can have hyperacidity and GERD. But you can also have hyperacidity and not have GERD. Okay? Because if you have hyperacidity, you can have other problems aside from GERD with hyperacidity, like I've talked about it before in a previous medical education stream about esophagus and stomach. It was about hyperacidity, like peptic ulcer diseases. When your stomach has a lot of acid, it's very acidic that it causes that you start having ulcers in your stomach to the point that it bleeds, or to the point that you perforate your stomach. So that's a whole different that's a whole new different topic, which I already talked about before. Because those are diseases that I deal with a lot, because they are really surgical, like emergency surgical. Hello, Tao-kun. Good evening. GERD ba da kung lubilipad? Magkagumagkumpuan mo. Is acidity curable? Oh, that one is it is curable. It is, but like if you want like curable where you're not gonna take maintenance medication, then yes, but that's a surgery. That's a surgery. More like what people do nowadays when it comes to acidity, you just control it. Because when it comes to acidity, it's better to just, it's better to just have medications for it. That's why PPIs are a thing. Proton pump inhibitors, omeprazole, the almighty omeprazole, to control the acidity. Because surgery for acid is kind of complex. I've like surgery for acid, I have not done one before or seen one actually. So it's rarely done nowadays because of medication. Because of medication. Preventive medicine. More like controlling. It controls, because acidity, hyperacidity, there's different causes for it. Especially peptic ulcers, there's different causes for that. It can be your stomach overproducing acid. It can be a bacteria in the stomach making that acid production, making it worse. There can be what do you call this? The acid production is not controlled. So there's different types of causes. No coffee for me. Yeah, that's basically no coffee for you. No caffeine actually for you guys. Well, no. Well, actually, it depends. You can it doesn't mean absolutely no caffeine. You can drink just a little bit, but or there you go. Cold brews are pretty low in acid, not as strong. Yeah, it depends. It's like we would, if you go to your doctor, we would advise you to at least avoid those types of things. Avoid caffeinated drinks. But you can have a little bit. But see, it depends on your body also, because sometimes people who have that, they have a little bit, but then they can't handle it, or their body can't take it. So it really depends. That's why it's better to just say, better to avoid. No. Alright. Okay, symptoms of symptoms of GERD. Okay, one is symptoms of GERD. So the most common what do you call this? Symptoms of GERD is regurgitation, or reflux. Regurgitation, because once the acid refluxes and goes up to your esophagus, it's basically, you're basically gonna regurgitate. Whatever goes up your esophagus is gonna come out through your mouth. Okay? So that's one. And when you do regurgitate acid from gastric contents from your mouth, you're gonna have heartburn because it's acid, right? acid from your stomach going back up to your esophagus. The esophagus is not built to have gastric acids going through there. So you'd experience a heartburn. Okay, heartburn is actually not a pain from your heart. It's a pain caused by the gastric acids going up to your stomach. So it's kind of a misnomer where they say heartburn and they think it's from the heart. But nah, it's not. It's actually you being acidic and that acid's refluxing, going back up through your esophagus. Okay, it's like a chest. It's similar to a chest pain. So if we have a patient that has a history of heartburn, but then also has is a high risk person for heart attacks, we gotta make sure to differentiate the two. Is the person experiencing this chest pain because it's a heartburn, or is it because he's having a myocardial infarction, a heart attack? I'm running out of water. Okay, the next most common symptom also is dysphagia. Dysphagia is basically difficulty swallowing. So you try to swallow, but instead of the food going down your esophagus, it goes through your trachea, your airways. So you start coughing, choking. So not really not choking, coughing. You start coughing because whatever you swallowed went to the wrong tube. I just remembered my case from last year that made me nauseated and gave me stomach pain. And I have no idea what it was, but I was given prescription of antacids and paracetamol. Was that only from last year, or does it frequently happen? Okay, there are other symptoms of of GERD, the more severe ones. So these are just like the typical symptoms, the ones I said. There's also, you can also have like symptoms that are like not related or not related to the esophagus itself. Like let's say coughing. Coughing is not really, although coughing is from aspiration or from the difficulty swallowing. But it's more of coming from the airways, right? So coughing, there's also like sore throat because of the acid irritating the throat. And sometimes there are some patients who also, because of the acid always coming out, even their teeth get affected. You know, the teeth, if you chronically have acid coming out through your mouth or vomiting acid, it affects your teeth. Like it would erode your teeth. Okay? And also ear infections. There we go. Ear infections. Otitis media. Because the ear is somewhat connected also to the to the throat and the nose, the airways. There we go. It was last year and it lasted for like a month. I was always so restricted from eating oily foods and milk. Okay. Have you ever had any other have you ever had an ultrasound done, Fat Master? I had sore throat. Oh, okay. I mean, yeah. If you have GERD and then you had sore throat, most likely if you kept regurgitating all the acid, it irritates the throat. Okay. Okay, workup. How is it diagnosed? Okay, for GERD. For GERD, okay, for gastroesophageal reflux disease, the symptoms are very similar to other diseases. So if you have like regurgitation, that's basically like a vomiting, or if you have stomach pains, abdominal pains, there are many other diseases that cause that. And one of the most common ones is gallstones. Gallstone is a differential diagnosis. So that's one. That's why when people talk about, when patients say like, you know, they have stomach pain or parang reflux, when a lot of patients, when they say may reflux ako, like that, or acid, and they consult me, I always request an ultrasound because I gotta rule out gallstones. Okay, I gotta rule out gallstones because it can be similar. Okay. I think I had a patient actually last year. That it was initially treated as a case of GERD because he's always having he always felt acidic, or he always felt like vomiting, his abdomen would hurt. He was treated as a case of GERD until I requested for an ultrasound because his other doctor treated him as GERD, and I told him get an ultrasound. And then when he got this ultrasound, and there it was, gallstones. I'm like, hey, I told the patient, hey, you got gallstones, we gotta operate on you. And so I operate on him. I removed the gallbladder, and ever since he had that surgery, he never had another episode of that regurgitation, of the vomiting and the pain. So that whole time he was, the whole time the everything was caused by gallstones. So it can be similar. Okay, that's why you gotta rule out gallstones. If there's gallstones, you gotta remove it. It might be that. Like, there can also other differential diagnosis or similar, like just, gastritis, even hiatal hernias can also be even hiatal hernias. Actually, hiatal hernias can also contribute to GERD. Unfortunately, I did not really talk much about I did not put much about hiatal hernias here. But a hiatal hernia is when a portion of the stomach herniates through the diaphragm. Let me see. Where is the anatomy of the? Here it is. This one. Okay. A hiatal hernia is, you see this red line right here? This is the diaphragm. So there's like a little hole over here where the esophagus and the aorta and the other the aorta major blood vessels go through. It's when a portion of the stomach goes through the same hole, just like a hernia herniates through the same hole. That's a hiatal hernia. Okay. So that can also kind of contribute to reflux, to GERD, because when your stomach is like herniating through this, it can interfere with the functions of the esophagus. So yeah. So when there's a hiatal hernia, that is surgical. That needs to be operated on to correct it. And those who have hiatal hernias, once it's corrected, they actually improve really well. So yeah. I had cough and sore throat for weeks. Turns out it was GERD, not a respiratory. Oh my god. Yeah, that does happen. Some people have different symptoms. like atypical symptoms. Does milk trigger gallstones? It can. It can. That's why a lot of patients ask me, can I drink milk? And I'd be like, best to avoid that. Because some patients get triggered from dairy. They drink like a glass of milk and their stomach hurts. Okay. What else? Yeah, there. Okay. Okay, workup. How do we diagnose GERD? So, one of the diagnostics is an EGD or an endoscopy. So, this is when they sedate you. You're on a table, lying on your side. They'll sedate you, and then they'll put this little camera through your mouth. They'll put like a little mouth opener here, or that I forgot what you call it. The oral it keeps your mouth open, and then they'll put the camera inside. The gastroenterologist will do this. So they put the scope inside, explore your esophagus, all the way until your stomach, usually until the duodenum. They'll just look around like, hey, okay, this patient's esophagus has pink mucosa, looking good, yada yada yada, and they'll look at the sphincter, the LES, they'll go through it, and then look at your stomach like, oh, this person has ulcers, stuff like that. Like a speculum? No, it's not a speculum. It's a camera. It's a scope. It's a scope. For the mouth, it's not a speculum though. It looks like an oral airway. I think it's like an oral airway, but it's not. I forgot what you call it. Laryngoscope? No, it's not a laryngoscope. I had that procedure early this year. I had GERD and was exacerbated by H. pylori. Oh my god. Yeah, that's gotta be. Well, at least they found the H. pylori and that gets treated. Because H. pylori, yeah, really wrecks your stomach. You could get you can get surgical complications from that. By the way, I've had a lot of patients who had freaking gastric ulcers because of H. pylori, and they needed emergency surgery. Because they either bled or perforated through the stomach. H. pylori. Okay, so yeah, one of them is so as I said, one of the workup is endoscopy. So usually in endoscopy, what they're gonna look for is they're gonna examine your esophagus, and they can tell through the endoscopy if your esophagus has been irritated, like there's like little red patches, or they can find near the distal part of the esophagus, over here, there is what we call the Barrett's esophagus. Can I write it down? Will I be able to write it down? Barrett esophagus. So this one is this is what we need to watch out for. For those who have GERD, this is what you don't want to get, by the way. For those who have GERD, you don't want this. Okay, so Barrett's esophagus or Barrett's esophagus. So the esophagus is made, the lining of the esophagus, the cells of the esophagus are mostly made out of cuboidal. We call them cuboidal cells. Okay, they're like little cells that are like, they're basically cubes, right? Lined up like that. Cuboidal cells. Imagine this is the lining. In a cellular level, the lining of your esophagus is like that. When you have a Barrett's esophagus, which is what happens is because of the acid that refluxes, goes back to your esophagus from the stomach. The acid irritates the wall. Okay? It irritates the esophagus. And anything that irritates a surface chronically in your body, okay, can cause eventually the cells, how do you say it? More like your esophagus, quote-unquote, adapts to this acidic environment. And what happens is the esophagus tries to, the cells of the esophagus turn into the cells of the stomach, which is columnar. So they look like this now. They look like columns. Instead of cubes, they become like freaking columns. Columnar cells. Which is the cell lining of the stomach. Okay? And that is not normal. That is not supposed to happen. Your esophagus is supposed to be cuboidal. Because, see, the thing with this, the thing that's dangerous about this is that, you know, like in anywhere else in your body, if a certain surface on your body or anywhere in your body gets irritated chronically, like all the time, irritated, yeah, it's like it mutates. There are changes that happen. It would scar, and then you would irritate again. What happens is, it can become cancerous. Okay, it's the same with skin cancer. You're out there in the sun every day, getting your daily dose of UV radiation. Going out there, so your skin is getting burnt every day. Let's say you've been doing that for years, going out there without sunblock, getting burnt by the sun, you'll eventually get skin cancer. Okay? It's the same with the esophagus. So acid keeps going up all the time for years, and then eventually the esophagus, the lining of the esophagus turns into, from cuboidal, turns into this columnar. And this is cancerous. Okay? It's like overworking your cells for so long. Like, they would try to recover and try to adapt and all that. They're overworked that they become chaotic and they just turn into cancer. Okay? They just get chaotic in there. Turn to like weird chaotic stuff. Okay. The corpse husband voice causing. Oh yeah, it does. It can affect your voice because of the acid. If you're always having a reflux of acid in your throat, it can cause some changes in the voice. So, Barrett esophagus is one thing that a lot of doctors or gastroenterologists who are handling people with GERD, they want to watch out for this. Or any signs of that. Because as soon as they notice that in the distal part of the esophagus, there's some weird stuff going on there. There's some weird stuff going on there. They're going to get biopsy. Okay. They're gonna get biopsy. And then depending on that biopsy, on how bad, or how do you say, how high if it is a low grade or a high grade type of, dysplasia, or, you know, in the biopsy, it's either they'll monitor it, or you might have to have a surgery for it. So, yeah, that's why you gotta watch out for this. You gotta make sure this doesn't happen. Okay. Cells really do be at work. Yep. You gotta overworking your cells. Alright. So, next. Another workup, aside from endoscopy for GERD, they also have the esophageal manometry, which is basically it measures the pressure of the the pressure in your esophagus. So usually this is for like diagnosing other esophageal disorders like achalasia, nutcracker esophagus, and all that. I've never actually seen one of these at work because I'm a surgeon. As a surgeon, I don't need to deal with this one. So this is done. I think this is more done by or requested by gastroenterologists or other doctors. Because the only time us surgeons get a patient like this is when it's, when it's surgical already. But as surgeons, we don't really handle this. Okay. So it just measures the pressure in the esophagus. So if the LES is working properly or not, yeah, this is it. I haven't seen one of these machines though. And then another one is this, which is a 24-hour pH monitoring. So this one's basically monitoring the acidity of the stomach. They put a little tube through your nose and it's connected to a little monitor here. So this tube is gonna monitor the acidity on the area of the esophagus. So if there is reflux, then the acidity in this area will be high, or it'll be about the same level as the stomach, which is not supposed to happen normally. Okay, so they do that. It's like a measuring. It's like having. It's like It's 24 hours, by the way. So you're gonna have that what do you call this? This thing on, this machine on for 24 hours. On your while you go about your day. Cyborg upgrade. So yeah. Again, I have not seen this in actuality. I actually don't know, since I worked in a government hospital. They don't have this. In a government hospital, they don't have this. At least I haven't seen one. So, yeah. Even the other one, I haven't seen this. Probably in private hospitals they have these, but I have not seen one. Okay. Okay, treatment. Treatment, guys. How to treat GERD. So, when you have GERD, there's at least three goals. One is to control the symptoms of GERD. So you just want to make sure that the patient is not, you want to make sure that he or she doesn't reflux. And that the acid stays where it's supposed to stay. Okay? If the patient has esophagitis because of the reflux, then you want to take care of that. You want to heal it and make sure that it doesn't, repeatedly happen. And you also want to prevent other complications. So one of them, as I said, is the development of Barrett esophagus. Okay. So this is what I mean by GERD can be mild. It can be mild, where you start having like simple refluxes and then you are diagnosed early, so you have it controlled. Okay. But it can also be severe, wherein, you start developing Barrett esophagus, or, if the acid always goes up to your throat, you can have changes in your voice, or again, sore throats. You can aspirate because sometimes you have a difficulty swallowing because of the GERD, that whatever you vomited out or regurgitated goes into the wrong tube that you're breathing, your windpipe, your trachea. So yeah, what we want to do is prevent that from happening. And how do we prevent that from happening? there are three ways to control or prevent GERD. And one of them is lifestyle change. Okay? Lifestyle change. So, if you're overweight, you gotta lose the weight. Okay? It's one of the treatments. There's also avoiding certain food. Like anything that's high in acid or fatty, you want to avoid those. Okay? And then when you're eating your meals, you want to have your meals at small you want to have them like divided into more frequent meals, small frequent. So instead of having like breakfast, lunch, dinner, you're gonna have breakfast, a small breakfast, and then you're gonna have like a snack in between, and then a small lunch, and then a snack in between, merienda ka, and then small dinner. Okay? The reason for this is that you want to make sure your stomach is not too full. So you just eat a little bit at a time. So it's like you eat small, give your stomach some time to digest, and then have the food go down to the small intestine, and then you eat again, just a little bit. Okay. And then another one is after eating, don't lie down until after 3 hours. Okay. You will regurgitate. You will regurgitate, okay? So, if you absolutely need to lie down though, if you absolutely need to go to your bed for some reason, earlier than 3 hours, then when you lie down, it is better to lie down on your left side. Yeah, on your left side, okay? Than on your right. Or, when you lie down, you have your head elevated a little bit. Okay, not flat. Because if your lower esophageal sphincter is not working properly, you're gonna regurgitate. And the reason why on the left, why do we lie on the left and not the right, is because if we go back, to the anatomy of the stomach, I'll show you why. We go back to the anatomy of the stomach. Oops. Here we go. Remember how the stomach looks in the body? Here. This is the left side. This is the left side, and this is the right side. Here. Left, right. Okay, left, right. The stomach is here. It's like this. This is the middle of the stomach, and then this is where the esophagus goes through, like that. The reason why you lie on your left is because there is an area of the stomach here called the fundus, which you can see over here. This. If you lie on your left, the food you ate or whatever's inside your stomach will go here by gravity. It's gonna go to this side. Whereas if you lie on your right, your esophagus is on the right side of the stomach. So if you lie on your right, whatever's in your stomach is gonna it's gonna reflux back up. It's gonna reflux. Okay, that is the reason why when you lie down, when you have GERD and you're gonna lie down, it is better to be lying on your left than on your right, and with the head slightly elevated. Okay? Malakas din daw maka-acid yung skyflakes. Totoo ba? Skyflakes? Wait, why? I have not heard about that. About skyflakes causing acid. Skyflakes acid. Is it because of the Is it because of the what? Is it? I think it's because of the. Oh, I think it's because of the sodium. The salt. Although there's no actual like scientific evidence for this one. At least I haven't heard about. At least I haven't heard about the skyflakes. Like, what do you call this? Skyflakes aggravating acid reflux. My acid on crackers. Skyflakes is salty. If you had GERD, you're evolving into a xenomorph. Bro, yeah, that's why you have heartburn. It's the what do you call it? Those babies busting out of your chest. Okay. Alright, and then next. Okay. Next. Oh, wait, what's this? Chest boosters. Kaya pala ma-chest burster ako. Nakaka-trigger ba ng acid ang yosi? Oh, yeah, smoking! Yes! If you have GERD, it's better to not smoke. Don't. It's more like the the act of smoking weakens your or affects your lower esophageal sphincter. So yeah, you're gonna have GERD. If you have GERD already and then you're smoking, it will affect your lower esophageal sphincter. You will aggravate your GERD. So basically, when you have GERD, you gotta live healthy. You have to have a healthier lifestyle. Okay, next is medical management. Okay, so aside from lifestyle changes, there's also medical. Okay, so you have to be on antacids. There's also meds like the H2 receptors or H2 blockers. There's also proton pump inhibitors. The most common one is omeprazole. This is the very, very common drug given. Okay, omeprazole is a PPI. It's a proton pump inhibitor. The only good antacids. But yeah. So there. That's if you notice the management or the conservative management for GERD is mostly it's not exactly curative. There we go. If you notice that the conservative management is not really exactly curative, it's more preventive and controlling the symptoms. So like lifestyle modifications, this is basically preventing any thing that would aggravate the reflux. That's why you have weight loss, avoiding certain foods that increase acidity, because you don't want those acids going up your esophagus. Eating small frequent meals so that you don't reflux, and not lying down after 3 hours so that you don't reflux. And then there's the medical treatment that helps control the acid production. So if you notice, those are all they're not exactly curative. They're just controlling or preventing worsening of the symptoms. Now, if we're gonna talk about cure, how to cure GERD, we're gonna talk about cure where you don't need to take all this stuff. That's where we step in as surgeons, okay? Surgical. Okay. If all else fails, let's say you're doing the lifestyle, you're living the healthy lifestyle, but you still get GERD, you still get the reflux symptoms. You're taking medications and yet you're still having the symptoms. All else fails. Then that's when your doctor or your gastroenterologist, whoever's in charge of you, is going to refer you to a surgeon. Because everything they're doing is not working. I guess surgery becomes like the last option. But there's also other reasons for, other indications for surgery aside from that. So you can't surgery is offered if the GERD can't be controlled medically. Okay, if there is, as I said before, if there is a Barrett esophagus, then yeah, you need surgery. Because you gotta take that part of the actually, that one is a major surgery. You gotta take that part of the esophagus out already. And then, if you start having more severe symptoms that it's already bothering or really affecting you, and also in very young patients, because you don't want to have these young patients if they're really young, like a teenager or even younger. You don't want to subject them to just having like maintenance medication all throughout their life. So that's why surgery becomes an option for them, so they don't have to go through all that. Okay. And if you have a patient na matigas ang ulo, hard-headed patient, like, no, I don't want to change my lifestyle. I want to smoke. I want to drink. I want to eat whatever. I want to eat spicy food. I want to lie down 10 seconds after eating. You know, those ayaw maggamot, hindi magano siya, magpo-opera na siya. People that don't want to take their meds. Or, because, eventually, kasi, young sinners. Yeah, eventually kasi, especially here in the Philippines, okay? You know how a lot of Filipinos cannot afford healthcare, cannot afford medicines. Sometimes in the long run, buying all these medications to help control their acid or help, control everything gets a bit expensive in the long run. Because, you can be taking omeprazole right now, but it's your maintenance medication all the way up to when you die. You can add up the expenses there. And then when you get older, you start having other illnesses from the age. Like, you start getting hypertension. You start getting diabetes. And di dumami yung diba? You start having more maintenance medication. So it kind of piles up eventually. Okay? It piles up. So, for these patients who don't want to have that, they can opt for surgery right away. So that's an option for them. Okay? Okay, so alright, okay. What's this? Preference for PPI versus H2. Oh, when it comes to GERD, the most effective and the best is actually PPI. But the reason why they have different options is because it depends on the patient. If the patient has no other problem with PPI, go for the PPI. But yeah, if there's like a contraindication for the PPI, then they take something else. Tirador ng Starbucks. Iinom ng gamot tapos siya shut na. Yeah, those kind of patients. There are patients like that. Even when you talk about patients with gallstones, like those patients who have gallstones, I had patients that, or I've talked to people that have gallstones but they don't want to have surgery because they're scared or they don't have money, and then they'll ask for alternatives or what to avoid eating. And I would tell them, okay, you have to avoid these types of food. Basically, anything fatty, fried, mamantika, oily, anything fatty, you have to avoid if you don't want to experience the pain of gallstones. And initially, they will follow that instructions, but then, it gets a little difficult because as soon as it's Christmas season, alam niyo naman dito sa Pilipinas, 'di ba, pag Christmas season, Christmas season, kakain. Noche buena. Medianoche. You know? And they can't resist. And then that's when all the gallstones get triggered. Eventually, they just come back and say, you know what, Doc, patanggalin na. Tanggalin na yung abdo ko. Hindi ko na kaya. Ang sarap ng pagkain. I had one. It's like I had one patient who told me like they discovered they had gallstones years ago, and then last year, and then they'd be like, I started eating healthy, ganun. Pero kasi pumunta kami dun sa bahay ng pinsan ko, birthday niya, tapos ang sarap ng pagkain. May adobo, may lechon, may ganun, may sisig. And she ate everything, and then she had like really bad abdominal pain So she's like, patanggalin ko na yung abdo ko, gusto ko nang kumain. The Last Supper ang pig. Kung dati paputok ang cause ng pagkaka-hospital during the holidays, ngayon pagkain na. Yeah, basically. Yung mga gallstones. Triggering gallstones. I've been under omeprazole for 2 weeks and I don't see myself improving. Is it possible that I have other underlying conditions? You have GERD? If you're an omeprazole, if you have GERD, if you're diagnosed with GERD, if you're diagnosed, surely to have GERD. Omeprazole is a lifetime. You're gonna be taking that. Plus, you also have to have lifestyle changes. Okay? You can't just depend on the medication. You gotta change your diet. You have to change your diet. You can't just rely on the medication. The medication is there to reduce the acidity, but you have to alter your lifestyle so that you don't aggravate the reflux. Okay? That's the thing. Buti na lang wala na akong gallbladder. Oh, ayan pala. You won't have that problem anymore. Lechon, crispy pata, bulalo, tapos malamig na ko. Yeah. Okay. Next. So, what is the surgery? What exactly is the surgery done for people with GERD? So, when you have, like we established, when a patient has GERD, the cause it's basically a reflux, and the reflux is because the lower esophageal sphincter is not working properly. So what is the surgical management? The surgical management for this is basically making a new improved sphincter. New and improved lower esophageal sphincter. And that is by creating a funduplication. It's called a funduplication, and there's different types. There's different types of funduplication. So we have the Nissen. This one I've seen. I've assisted one. There's also the Toupet. I don't know if it's called Toupet or Toupet. I have no idea how to pronounce this. The Toupet. And then there's the Door. But the most frequent one is the Nissen. So what happens is you get a portion of the stomach. In this operation, you just get a portion of the stomach and then wrap the esophagus. That's it. That's basically it. And it can be done laparoscopically or through traditional open surgery. So you basically just gotta free this area, pull down the esophagus a little bit, and then wrap it around with a portion of the stomach. Okay. The most commonly one done is this one. I have not seen a Toupet yet or a Door, but these are also options. Biglang tinupi. Yeah, that's basically it. Because what it does is, parang sinisikip niya yung esophagus, right? If you have a really loose lower esophageal sphincter and it's not working properly, you're gonna wrap it around with the stomach to like make it a little tighter so that it works properly. And then a lot of patients, when they have this done, they are well. They are very well. Of course, there are some instances where, there's a recurrence, but the most common recurrence is usually when there is a herniation. But basically, this is it. This is the treatment, the quote-unquote permanent treatment for GERD. But see, like I said, this is a last resort because surgery is invasive. It's an invasive procedure. So if you can control everything, if you can control GERD with medications and lifestyle changes, then that's actually better. That's actually better because it'll also help you eat better, eat healthy, live a healthier lifestyle. This is only for those surgeries, only for those who have failure in treatment, failure in medical treatment, or just don't want to be taking any medications. Malaking part ba ng stomach na gagamit dyan? Like, mababawasan ba yung spaces? No, it's not really. It's just this. It's just the upper part. This part right here. You just wrap it around. If you like mababawasan ng space, like, it's not that big of a space na that gets reduced. So, yeah. I heard a process of stomach reduction that helps with weight. Oh, that's bariatric surgery. That is bariatric surgery. Some people who have GERD, they also undergo a bariatric surgery. If they are like overweight or obese. So, yeah. I heard you can't vomit anymore with a Nissen, etc. Oh, that is possible because of you've tightened the sphincter. It can happen. It's a common occurrence. Because it's like when you do a Nissen, there's like it's a tight wrap around the LES. So yeah, it affects your ability to vomit. So it's like it's more like a, once you swallow, there's no turning back. Something like that. Once it goes down to the stomach, there's no turning back. So it's just gonna go down. The doctor told me to take a high-fiber diet together with omeprazole. My weight dropped a bit, but I'm slowly gaining. Yeah, it is. You really have to have a lifestyle change. If you need to drop your weight. Just aside from the omeprazole, and also watch what you eat. When you eat, don't eat like full meals, 3 meals. Divide it into smaller portions, like Instead of eating 3 full meals a day, you can eat 6 smaller meals in a day instead. Like a small breakfast, a small snack, a small lunch, a small snack again, and a small dinner. Okay? That's basically it. Because it's really, GERD is not, how do you say? It's a disease that is not just simply treated or cured or, you know, with just taking medication. It's like you have to do a lot of things, because if you want to avoid surgery, you have to control the acid production, the acids in your stomach, and you have to avoid things, food, or instances that would aggravate or promote reflux. That's why they say weight loss is important, and avoiding and then not lying down right away after eating, having small meals. So it's like a combination of controlling the acidity and preventing the reflux. Okay? That's like the conservative management for it. And then surgery is just for those who like don't want to take meds anymore, or it's not being controlled anymore. It's so severe that it's not being controlled anymore by meds. Thank you for sharing this. I feel represented. No problem. Hello, Cedium. Hello. I'm seeing. Wait, you know what? I'm noticing a lot of new people here. Hello to the new people. Doc, what's the difference between? Oh wait, thank you for subbing, Cedium. What's the difference between omeprazole and lansoprazole? Oh, okay. They are both PPIs. They're both proton pump inhibitors, but I know there's like different kinds. There's omeprazole, there's lansoprazole, there's pantoprazole, there's esomeprazole. As far as I know, I think lansoprazole is faster acting than omeprazole. Like omeprazole is I think omeprazole is the cheapest one as far. I'm not sure. Okay, I think it's the cheapest one here and the most available. There's like different and as far as I know, they have different PPIs depending on the patient. Like I don't remember everything, okay, but I know lansoprazole acts faster and it's better. It is better for patients who are on other meds, on like aspirin, blood thinning meds, something like that. And then the others, it depends. I don't remember like the specifics for each drug, but there's like they're catered to certain patients. I've gone through them all. Okay. First time here, if I told you. Oh, okay. Yay! Thank you for the sub, by the way, CD. Thank you. Only swallow, no spit. Omeprazole is coming here for stomach. Yeah, omeprazole is like the go-to drug. It's like the almighty drug for stomach issues. And anyway, yeah, that is my last slide, actually. Yeah, that is my last slide, guys. It's actually pretty short. I keep my medical education stream short. At least an hour to an hour and a half. You guys have any more questions? Does lying on your left side actually help to be? Oh, okay. Yeah, I talked about this a while ago. Okay, I'll go back to it again. I'll tell you why they say lying on your left is better. I'll say it again. Here. Why is lying on your left better? Because if you look at the anatomy of the abdomen, your stomach is here. So your stomach is more to the left. The fundus of the stomach is on the left. And then... Oh. Thank you for the member, Hika! Thank you. Okay, so... The stomach has a portion that's on the left, the fundus, and then the body is on the center. Now if you go here, if you look here, it's closely at the stomach. So, oh wait, if you go back here, like this is the left side of the body, this is the right, this is the left, this is the right, and... Thank you for... Hey, thanks for the gifted memberships, thank you! Gifted to how many? 5 people, nice! Thank you! I should do more membership streams soon. Alright, and continuing. So... Knowing that that's the left and the right, that this is the left side and this is the right side. So if you lie to your left, whatever's in your stomach is going to be, you know, by gravity, it's gonna go down here. By gravity. So if you ate some food, by gravity it's just gonna be here, right? Now if you lie to your right side, the sphincter is right here. So if you lie to your right, the food can just like freely go up there. It's not that it improves the acidity. It's more like a mechanical, like trying to prevent the reflux from happening while you're lying down. So lying on your left is better because the food by gravity is just gonna be here and it won't reflux anywhere else. Compared to lying on your right, if you have a faulty lower esophageal sphincter, you're gonna reflux. Yeah, it'll spill over. Yeah, pretty much. Yeah. So it's not that it helps you be less acidic. It's just more like by physics. By physics. Is GERD an indication for any... What do you mean by indication? What do you mean by indication for any comorbidity? I don't understand. Wait, I don't understand your question, Simon. I see the power of physics. Yes. Will miso, ginger, and kimchi help with my gut health to avoid GERD? Ginger, I think... Ginger, as far as I know, can help. Like, it has some herbal, effects. Ginger. I know it can... It can help with, inflammation. So, in that way. Kimchi, I am not so sure about kimchi, but isn't that spicy? If it's spicy, you're supposed to avoid that. You're supposed to avoid spicy stuff. Does having GERD signify underlying sicknesses? Yes, it does. GERD can also be caused by a hiatal hernia. So, as I said a while ago, a hiatal hernia is when your stomach, a portion of your stomach, so if this is the diaphragm, the muscle that helps you breathe, there's a hole, there's an area with a hole where the esophagus and the blood vessels go through. The stomach is herniating through that. It can also contribute to the GERD. Also, pregnancy, well, pregnancy is not a sickness, but the physiology of pregnancy, like if a woman is pregnant, the uterus, the enlarged uterus with a baby inside, can also push on the stomach. So when the stomach is being pushed, it can push out the the gastric acid back into the esophagus. Or let's say you have a big mass in your abdomen pushing up into the stomach. That can also. GERD's looking kind of popular to younger people. Any reason why? GERD on younger people? It can be because of lifestyle. But I did notice that a lot of people have GERD. Fortunately, I don't. Fortunately, though, I don't have GERD. At least, I don't think I do. I remember one time I ate, and then what do you call this? I just suddenly like regurgitated. It happened once though, it didn't happen again. So at that point when that happened to me, like, what the hell? I had a reflux, and I'm like wondering, am I gonna have GERD? But yeah, it was only a one-time thing. I know this is anecdotal, but boiled saging and nasaba and cabbages and soup always help me. Ooh. Ayun, pwede naman. I don't think there's anything with banana and cabbage that would aggravate. But, let's see. When it comes to, like, the people affected by GERD, I guess you can say it's related to lifestyle. If they eat a lot, or mostly GERD. I know GERD is more like a little older people, not exactly younger people. I'm not really sure about the trend of GERD now in if it's affecting more younger people than older people, but it's usually an older people thing. I'll be watching the ball like an online class I slept through. Yeah, exactly. That's why I keep my medical education streams like 1 hour to an hour 30 minutes, because for those people who want to watch it again, at least it's not too long, you know? Doc, not sure if you covered this already, but what's the difference between GERD and stomach ulcer? A stomach ulcer is an ulcer in the stomach, basically. A wound in the stomach that can either bleed or perforate through and through. GERD is reflux, when the gastric acids go back up to your esophagus. That's the main difference. Instant regurgitation as well. Yeah, I just like ate, and then I don't know. I think I like waited for an hour, and then I lay on my bed, and then I just like vomited. It just happened once. I was like confused. I was confused that time. I was like, what the fuck just happened? And it didn't happen again. I was like, what the hell? Probably my sphincter was like asleep at that time or something. I don't know. Taking a break from work. I think it's probably because sagging is sometimes very mild in the stomach. What causes GERD mostly for me is stress and skipping meals. Oh god, yeah. Doc, random question. Can you explain why some people vomit in their sleep without noticing? Wait. Oh, you mean like naglalaway? Is that what you mean? It can also be because if they have GERD, that can happen. That's why some people actually aspirate in their acids, man. I guess that's what you're talking about when you mean foam. If they have GERD, the gastric acid is going back up in their thing. It can be because they've had it so long chronically that they can sleep through it, and then when they wake up, they have... Usually those who have GERD or reflux, they say that you have bad breath, more bad. It's like your breath is a lot worse than usual when you wake up in the mornings because of the acid. You smell like acid breath. In other words, you can have both stomach ulcer and GERD at the same time. Yes, you can. It's completely possible. It is possible. And that's actually bad. That's actually bad. Imagine having GERD and then an ulcer. That is pain. Sometimes I wake up actually choking on stomach acid. It's terrifying. Ugh. Yeah. Maybe try sleeping on your left side. Maybe if you well, that's gonna be hard though, like constantly sleeping on your left side. But at least, you know, it's just gonna stay on here. But yeah. Anyway. But yeah, that is all. That is all for tonight, chat. Imagine if stomach acid burns your... Okay, it's not gonna exactly burn your sheets. The acid is not strong enough to burn through cloth, as far as I know. Okay. Yeah. I hope me drinking Yakult once a day prevents me from having it also. I already have GERD, I don't want to get problems. Ooh, Yakult? Yakult is... I like Yakult. Yakult helps with the gut flora, actually. It is a probiotic. Helps with the gut flora. But I recently saw like a video or a post by Doc Adam saying that he said that Yakult isn't as well. He had a point though. He said Yakult isn't as good because it has sugar. Which is true, it does, because Yakult is basically a sweetened probiotic drink. But it is something that you're not supposed to drink like freaking 3 times a day or like water. So that's why it's in a small bottle. I think once a day is fine. Yeah, I saw that. Yeah, the one of the Yakult. I saw it, I looked through it, and I was like, wait, what? And then when he talked about the sugar level, I'm like, ah, yeah, that makes sense. That makes sense. The sugar level of Yakult. Like, basically, there are better options other than Yakult. But Yakult shouldn't be... You shouldn't drink Yakult like it's water. It's just a... That's why it's in small bottles. Yogurt? Depends on how the yogurt's made. There is sugar-free yogurt. There are some yogurts that are healthy. There are some that are with sugar. So yeah, but see, even when it comes to yogurt, the serving is still small. It's something you don't eat like all the time. Sakit. Sa ngipin niya Yakult mataas sa sugar dahil sa food tip ng bacteria na sa yeah. I like Yakult, to be honest too. When I have stomach pains or stomach problems or like diarrhea or anything, I drink Yakult. I do drink Yakult. I like Yakult. But I don't drink it like it's... I don't put like a whole liter in my jug here or in my aqua flask. I just drink like 1 bottle a day. It's not every day. My friend can't drink Yakult kahit may GERD siya. Does he reflux? So mas full of sugar pa rin po yung yogurt sa malls at ilaw. You know, I used to pronounce that ilaw. But when the yogurt's there, I think I don't know if I don't know what the content of their yogurt is in Lao Lao. Lao Lao Yao Yao. Is it lao lao or yao yao? I used to think it was ilaw ilaw. No, I'm gonna pronounce it lao lao. Yaw yaw, or yaw yaw, lao lao yun, lao lao. I'm pronouncing it lao lao. I don't care. But yeah, but basically it does have a lot of sugar when you add all the stuff on the yogurt. Unless you're gonna have plain yogurt. But if you're gonna add all those sweet fruits and all the chocolates and all that, sugar. Double L's equals Y. No, lao lao. Lao lao. I really thought it was ilaw ilaw the first time. I was like, ano ilaw ilaw ba yan? Anyway, it is 10:42. I think we're good for tonight. We're good for tonight. I hope you guys learned a lot. My next stream is gonna be here on YouTube. Tomorrow, I'm gonna have another stream here on YouTube. I'll be playing a Doctor Life Simulator game. So basically, it's me playing a game about my life. A day in the life of Shiori in a video game. Simulator game. Shiori Simulator. Or I don't know, Doctor Simulator. Thank you, Dime. Now I'm rethinking my life choices and my diet. Yeah. Salamat po. Okay, Sela. Thank you guys for coming to my stream. I hope you guys learned a lot. And I'll see you guys tomorrow. Oh, and Hika, thank you also again for the 5 gifts. 5 gifted memberships. 5 gifted memberships. God, I am not used to YouTube. I'm not used to YouTube. I'm a Twitch streamer. What's up? Bye bye. Good night.